I'm going to discuss the very high unmet medical need for follicular lymphoma, and this is the subgroup of the follicular lymphoma patients who are resistant to the immunotherapy. So it means the patients who basically progress while being on immunochemotherapy or immunotherapy, or progress within 6 months after the end of the treatment. And the outcome of this patient is rather poor. The median progression-free survival based on the different drugs like the Bendamustine, idelalisib, radioimmunotherapy, ofatumumab is varying between 6 to 10 months only. And I'm going to discuss the results of the GADOLIN trial, which was focused on the whole spectrum of the indolent diseases, but I'm focused only on the follicular lymphoma subpopulation, which forms approximately 80% of all patients. And this patient should be, by definition, resistant to ritxuimab. So it means that they have to fulfill the criteria, either progressing on immunochemotherapy or immunotherapy, all within 6 months after the last infusion of the rituximab. And these patients were randomly assigned to the standard treatment, which is Bendamustine, 120 milligrams per meter square for 6 cycles, or to the experimental arm, which consisted of the combination of the Bendamustine plus Obinutuzumab for 6 cycles. The dose of the Bendamustine was a bit lower, 90 milligrams per meter square, and the dose of the Obinutuzumab was just the flat dose, 1000 milligram per infusion. And patient who responding then were treated during the maintenance phase for 2 years. So it's just a standard approach, Bendamustine, versus the combo approach, induction, Bendamustine plus Obinutuzumab, and maintenance with Obinutuzumab. And it's very important to notice that the trial was highly positive in terms of the improvement progression-free survival from approximately 14 months by the Bendamustine to the around the 29 months, so it means doubled compared to the Bendamustine, and it means the risk reduction of the death or progression by 52%. So in this subgroup of very poor prognostic patient with follicular lymphoma, it really represents a significant step forward, and it's probably could be considered as a new standard of care.